Pharmaceutical giant Eli Lilly announced Wednesday that it will cap the out-of-pocket cost of insulin at $35 a month. Diabetes affects almost 1 in 10 Americans, and more than 7 million Americans rely on daily insulin to survive. And for many people, insulin is extremely expensive. A 2021 study based on a CDC survey found that nearly 1 in 5 U.S. adults with diabetes resort to rationing their insulin to save money. According to the American Diabetes Association, people with type 1 diabetes need, on average, 2 to 3 vials per month. For the uninsured and those with poor coverage, a month's worth of insulin can cost on average, $1,000 or more. Before the drug was discovered in the early 1920s, people with diabetes didn't live long. There wasn't much that doctors could do for them except encourage a strict diet. And even then, the prognosis for most diabetic people was not good. So when insulin was discovered, the inventors got an American patent and sold it for a grand total of, get this, $3. $1 for each of the inventors. That's it. They knew it was going to save lives, and they wanted to be sure it was accessible. But as patents have expired and the drug has been tweaked and improved, 3 major companies have driven the price of a vial of insulin through the roof. In the last 20 years alone, the average price of insulin has increased more than 200%, with some insulin product prices increasing by 1,000% in the same time frame. So what's behind Eli Lilly's sudden change of heart? Well, it's not just altruism. First, there has been increasing public and political outrage. Second, there have been policy shifts at state and federal levels. For example, last year, a provision in the Inflation Reduction Act attempted to cap the cost of insulin at $35. Republicans blocked the provision for anyone not on Medicare. And finally, Eli Lilly likely wanted to get ahead of looming market competition. In the last few months, a nonprofit generic drug maker announced it would begin producing insulin for no more than $30 per vial. Then California announced a plan to produce its own insulin capped at $30 per vial as well. Whatever the motive, the potential for this decision to spur a race to the bottom for insulin prices could bring us back to the inventor's intent that this life-saving drug is accessible for all who need it. Joining me now is Bharat Ramamurthy, the Deputy Director of the National Economic Council. Thank you for being here, Bharat. Really good to see you, man. So where do you foresee drug companies flowing, moving, going after Lilly has made this announcement?
Well, as you laid out very nicely right there at the top of the segment, this is going to make a massive difference in the lives of millions of people. And I think it's really a direct result of the president's use of the bully pulpit. Remember, for years now, over a year, the president has been calling out the fact that the price of insulin is way higher than the cost that it takes to manufacture it. A vial of insulin costs about $10 for the manufacturers to make. And then, as you pointed out, they turn around and can charge hundreds or even thousands of dollars a month for people to actually use the drugs. And people end up rationing it. People tragically end up losing their lives because they don't use the insulin that they need because of the cost. So the president has been saying that, laying out those facts now for a year. We're glad to see a company like Eli Lilly voluntarily go ahead and impose this $35 cap for people of all ages. We would encourage the other major manufacturers of insulin to follow their lead and do the same thing. And remember, as you pointed out, we've been pushing, Democrats have been pushing to impose this $35 cap by law. We had that in the bill that went through the House of Representatives. Senate Republicans stripped it out and limited it only to people on Medicare. And we're going to come back at this and fight to make sure that every single American, by law, gets this $35 cap.
So let's pick up on that point, Bharat, because you've got lawmakers, physicians, certainly patients, have been calling for this capping of insulin for years. So why is this happening now? Why does it seem the momentum finally seems to be aligning on the good side of health for people?
Well, as you pointed out, I think that the public pressure led by the President of the United States has been mounting now for months and months, and a lot of these manufacturers are starting to feel that push. I want to point out, I know we're focused on insulin, but this is not the only area in which we've seen companies respond to the president's spotlighting of improper unreasonable corporate behavior and fall in line. We've seen it in the family seating fees that American and Frontier Airlines charge people just to sit next to their kids. They voluntarily got rid of those fees following the president calling them out in the State of the Union. So what you're seeing here is a concerted effort by the President of the United States to go to bat for American consumers, to take on improper, unreasonable corporate behavior, and you have some corporations following suit. But I want to point out, none of this is substitute for getting a law in place. Corporations can change their mind, leadership changes, and the only foolproof thing here is a law that says that insulin is capped at $35 a month. Democrats are fighting for that law, and we hope that Republicans join us.
So help me understand why this is so hard. The inventors got $3. And you rightly noted it costs $10 to manufacture a vial. Why is it so hard for these companies to put on the market these life-saving drugs? Not just insulin. There are other drugs that fall into this. I don't think insulin is the exception in this regard in terms of the impact it has. Why is our health community so at odds, the business community so at odds with our health community to get these drugs into the hands of Americans who need them?
Well, look, corporations feel like their obligation is to maximize the amount of profits that they make every quarter. And if they can charge an extra $1 or an extra $100 per life-saving medication, they'll probably take advantage of that opportunity. It's on us. It's on the people, the political process, to rein that kind of behavior in. We are glad to see that some corporations like Eli Lilly are voluntarily changing these kinds of unreasonable practices and lowering costs for American families. Like I said, we encourage other companies that manufacture insulin to follow their lead and do the same thing. But we've been fighting, Democrats have been fighting to take on the ridiculous cost of prescription drugs for the last 2 years under the president's leadership. And remember, for the first time, Democrats got into law a requirement that Medicare be able to negotiate drug prices. So starting soon, every year, Medicare program is going to be negotiating the cost of 10 different drugs every year, bringing down the cost of some critical prescription drugs, and that's going to make a real difference in the lives of seniors over time. We need to deliver not only that provision, but we need to make sure that we cut prescription drug costs for everybody who relies on them, not just seniors. The Eli Lilly move is a big step, but we want to deliver more through the legal process.